Breast lift is an operation for any woman who comes in and says, I don't like the way our breasts look and I want them bigger. A breast lift is sort of a poorly termed operation, maybe should be called a nipple lift. But the goal in that operation is to pick up the nipple and remove the excess skin to get the nipple areola complex back sort of up on top of the breast mound. In those women, it's fallen down. It may be pointing down at the floor. It may just be sagging below the fold of the breast. At the same time, in the vast majority of patients that we do a breast lift, we also put an implant in. The implant typically will be put into a pocket which is under the muscle, and then we lift the breast tissue back up on top of the implant. In that case, the implant will give the fullness back to the upper part of the breast, and then by removing the skin and moving the nipple up will change the appearance of the breast. The downtime for a breast lift and augmentation is very similar to a straightforward augmentation. It's probably measured in terms of days to a week. It'll take several weeks for the scars to mature, but the actual downtime for the surgery is pretty quick. The amount of scarring is different in every patient. Depending upon the amount of lift or degree of lift, there can be a scar that is simply made just around the nipple areolar complex. This is called a concentric lift. And in the most extreme case, there's a scar that will appear like an anchor scar, an inverted T. Nowadays, most patients will end up with either a concentric lift, that's the scar around the areola, or a scar with a short vertical component or longer vertical component, like a lollipop type scar.